Dr. Kalyani, your pathology faculty in LearnElevate. So yes, today's topic is cellular adaptation. So before jumping into the topic, I need to have a talk about how we are going to approach this subject of pathology. So before going into the approach, let me tell you something. In this world, there are a lot of people. Some are heroes, some are villains, some are the lame guy, the stupid guy, and all kind of dramas, all kind of romance. Everything is happening in this world, right? A lot of stories. Similarly, very similarly, we have a world inside our body where there are heroes, there are villains, and there are stupid people, and all the drama that is seen outside is also seen inside. So the subject we are dealing with, that is pathology, has so much connection with drama of what is happening in the inner world. So that is the broad introduction I have to give about this subject, pathology. So before we jump into this topic, let's see how I'm going to approach this subject of pathology and how I want you to approach the subject. Okay? So how are we going to approach the subject is that we're using two different methods, both inculcated together. So how is it happening is that, what do you do when you're bored? Most of the people, 95% of the people is going to watch a movie, going to watch a series or something on Netflix, right? So, and if the story is so good, what will you say? Okay, it is so good, it touched my heart, right? So, and do you ever forget that story? You'll never forget that story. So stories are always etched to our hearts. So I want you guys to approach this subject of pathology like how you approach a movie that is so close to your heart, like a story. Like a story, we are going to deal with this subject, because these stories, if you attempt the subject as a story, then this is going to retain in your brain. It will not go. So it is very important to retain this subject, because this is the basic of all the clinical subjects that you are approaching or you have already approached. This is the very basic of all the diseases. So you have to retain the subject. So this is the best way to retain the subject, that is to do it like a story. And what is the second method? So what is the second method? The second method, so this I've already told, because stories always belong to the heart. And so who is this? This is American, but this movie, 3 Idiots, you guys all watched the movie 3 Idiots. And what is this scene? The professor is asking Ranchu, what is a machine? And what does he say? He says that machine is something that reduces our human effort, right? That is a very core concept of what a machine is. But the professor was impressed by what the other guy gave, the whole big sentence. But I want everyone to approach this subject like how Ranchu approaches science, because that is how you can inculcate this knowledge into your clinical thing and come up with a better and faster diagnosis. So we are going to deal pathology in two ways, like a story and like the Ranchu way. Okay, so that is how we are going to deal the subject. I hope you guys will enjoy this journey with me, and let's start. So today the first topic and the most basic topic. Before that, let me tell you what the pathology is. Okay, what does this subject mean? See, so pathology is the study of diseases. In other words, we can say pathology is a study of suffering. So what happens? So we have a lot of cells and tissues in our body, right? So when there is an external change, these cells there is some change happening to the cell. And finally what happens? This is progressing to a disease. So from the cause of the disease to the progression of how the disease is progressing and to how the result comes out. That the whole story is what pathology deals with. Okay, so it is changes happening to the cells and finally how it resulted in the so-called disease. So that is what is pathology all about. In big sentences, pathology means understanding the cause of disease and changes in cells and tissues that are associated with the development of disease. That is the big definition. Just understand, pathology is the study of diseases or suffering. Fine. So I am just explaining you with this with a very real life example. Consider a tire that your bike or your car something has, okay? Roads look like. So you are riding a tire on that road, and what happens? The tire is getting stressed because of the condition of the road. The tire is getting stressed, right? So the tire is getting stressed means what? There are a lot of wear and tear happening, and this wear and tear is going to result in what? Puncturing of the tire. So when a stress happens, wear and tear happens. So the tire is trying to adapt, and then after that what happens? It progresses into a disease, that is completely injured cell. Fine, understood? That is how it progresses. So what we are doing here is basically we are doing troubleshooting. That is, when disease is there, we are understanding what is the trouble that has happened to the cells and tissues, and we are troubleshooting the entire series of events that has taken place, and we are concluding how the disease happened in our body, and appropriate treatment is given. So we are doing troubleshooting in the human body. That is what we are doing as a pathologist or in pathology. Okay. So mainly pathology has two things, the etiology and the pathogenesis. What is etiology? Etiology is the cause of the disease, and pathogenesis is how the changes in the cells and the tissue is progressing into a disease. That is what pathology contains. So now we'll jump into our topic, that is cellular adaptation. So yes. See, this is a example. This is like I have compared it with the tire and explained. See, if there is one stress, what happens? Wear and tear happens, right? And if there is more stress going on, what happens? The cell is going to get injured. Just imagine like you are doing gym. What happens? The skin on your palm, it is going to get hardened, right? That is, the cell is trying to adapt. The cell is trying to adapt to the environment that is provided to it so that the injury does not happen. The wear and tear happens, and it is trying to adapt to cope with the situation it is in. For example, when you go to a very cold place, how will you adapt? You'll wear sweaters, you'll wear socks. That is how you adapt, right? So similarly, the cell adapt, and what hardening of the skin occurs in our hand. But what if more and more stress is applied? Then the cell is going to break off, and there is going to be an injury, a wound in your hand. So there is a limit by which the cell can adapt, and after that, if more stress is given, then there is absolutely going to be the cell injury. So here we are not dealing with cell injury. Here we are going to decode how this cell is going to adapt to the changes of the environment around the cell. Okay. This is just, I have added an image of the wear and tear that happens, the adaptation that happens to the tire, and finally when more and more stress is given to the tire, see the condition of the tire, it is damaged, or it is, in case of cell, it is injured. So that is what is about adaptation. So you understood now. It is the change in environment of the cell. The cell is going to adapt to accommodate the change, but if the change is going on continuously, then the adaptation has a limit, and then it is finally going to lead into a injury. That is the cell injury. So in adaptation, we have physiological and pathological adaptation. What happens in physiological adaptation is that it is always mediated by hormones, chemical mediators and all. For example, in puberty, what happens in puberty? Our our hormones, the hormones like the estrogen, testosterone, everything increases in our body, right? So when these hormones increase in our body, that is a physiological process. Resultant of that, what happens? The breast is going to become big, the uterus is going to become big, all this happens, no? That is a cellular adaptation to the change in the environment. What is the change in the environment? The increase in the hormones during puberty. So it is a very physiological process and it happens in everyone, right? Okay, and what is a pathological adaptation? Pathological adaptation means it is what the body is doing to escape the injury that it is suspecting. Okay, that is pathological. For example, we are going to learn the entire thing of pathological adaptation, how the body adapts. Okay, so these are the two type of adaptation that is there in the body. So next, let's move on to the topic. So here, this is the broad classification of all the adaptations. So here you can see the normal cells. You can see the normal cells here, and then you see there's some cellular stress is happening. Okay, when the cellular stress is happening, there are different kind of changes that is happening to the cell. See, atrophy, hypertrophy, hyperplasia, metaplasia, dysplasia. So we are going to decode all the terms and understand what is actually happening in the cells. All right. So I am using a factory to just entertain you guys with how this process goes. Okay, so this factory is the hero of the story today. So see what this factory is. This factory is a global business factory. So always remember about this factory also. This is a very new factory in your town. Global biscuit, very tasty biscuit they are creating. All right, so your family loves the biscuit, your friends love the biscuit, everyone is buying this biscuit. So what happens? What is happening now? Everyone is buying the biscuit, means the demand is increasing. So when in a factory, when the demand increases, what are they supposed to do? Either they are supposed to increase the number of workers of the factory, or the workers that are already there, he's going to be overworked, right? So let's see what happens. First case, let's see. So do you see a very muscular person here? So what happened here? The factory decided the first case, that is what? They're not going to hire new workers, but they are going to have the workers there to be overworked. So they're working hard, they're lifting weights, they're lifting all the big cartons and everything, and see, the workers have become bigger in size. So if there is increased demand, and so the increased demand is leading to the change in size of the cell, that is called hypertrophy. Okay, I've just given this as an example. This is a muscular guy. So you can see here a picture, an illustration. This is the normal size of the cell, and you can see on the right side the hypertrophied cells that are bigger in size. Okay, here what you should understand is that the number of cells is not changing. It is just the size of the cell. That is called hypertrophy. So what are the causes of hypertrophy? The increased function, that the cells are overworked, or there are growth factors that are chemical mediators, or there is hormonal stimulation. These are the causes that leads to what? Hypertrophy. And now we have two types of hypertrophy. That is the physiological hypertrophy and the pathological hypertrophy. So in physiological hypertrophy, I've already told about the uterus. So what happens to the uterus in pregnancy? In pregnancy, the uterus is going to become bigger. The cells are going to get hypertrophied. So that is an example of physiological hypertrophy. And in pathological hypertrophy, see, that is a left ventricular hypertrophy. I'll explain how this happens in our body, this left ventricular hypertrophy. So this is another interesting factor that you have to note, that is pure hypertrophy happens in cardiac muscles and striated muscles, because in these muscles we do not have the stem cell pool. That means the cells cannot divide to to become new different, like number of cells cannot increase because the stem cell pool is not there, and all the cells are in the post mitotic stage. That means it cannot divide to form new cells. So the pure hypertrophy without hyperplasia only happens in cardiac muscles and striated muscles. This is a very important point to be noted. So next we have this cardiac hypertrophy. This is a very interesting pathogenesis that we have here. So what happens when you're having hypertension? See, our heart is trying to pump blood to all parts of our body, right? So there is some blood pressure already that is there in the circulation. So what if there is hypertension? When the blood circulating is having a high pressure, then the heart is pumping the blood out. So the heart has to pump more harder to counteract with the pressure that is already there in the circulation and pump the blood outside to the veins and to the arteries, to the entire body, right? So what happens when there is hypertension? The muscles has to work, is going to work harder. It has to work harder to pump the blood. So what happens? The demand is increasing. It is overworking. So what happens is that there is a mechanical trigger to the cells, and these mechanical triggers are going to stimulate cell growth in the ventricles of the heart. And what happens? The ventricle is obviously going to be hypertrophied because the cells are going to become big because it needs lot of energy, lot of effort to pump blood into such a high pressure circulation. So that is how cardiac hypertrophy happened. And keep in mind, there is no hyperplasia, only hypertrophy, because cardiac and striated muscles are in post-mitotic stage and the hyperplasia does not occur in them. Only hypertrophy occurs in cardiac and striated muscles. Okay, that is the whole pathogenesis of how this cardiac hypertrophy occurs. And now let's move on to the next. So here you can see this is a cardiac muscle, and this is that one on the right side is a hypertrophy. You can see the size increases. You see the size is increased in this, no? So that is hypertrophy, cardiac hypertrophy. This is a histopath. So next we have hyperplasia. So see, come back to the factory. What happens in the factory? There is increased demand. So now the person, the CEO has decided, okay, we are not going to overwork the people there. They are our employees. We are not going to overwork them. We are going to hire more people because the demand is so high. So what happens? More and more people are hired into the business company. So what does that mean? When a tissue is having a lot of higher demand and more work is to be done, then a cell is going to divide and the number of cell is going to increase. That is called hyperplasia. Okay, the number is going to increase. That is hyperplasia. So you can see just an illustration like how we saw before, the normal cells and the hyperplasia, where the number of cells has increased. So this is another takeaway point that you can remember, that if the stimuli, there's a stimuli, change in environment, that stimuli almost all the time it stimulates both hypertrophy and hyperplasia. But if the cell is not capable to divide, then it is only hypertrophy. Okay, otherwise both can be triggered. Both hypertrophy and hyperplasia can occur together. Okay, that is a very important takeaway point you can remember. So what are the causes of hyperplasia? Same, the hormones, the growth factors, all these are going to increase, and this can. What are these growth factors? Growth factors are the messengers of the cell, which gives the message to cell to divide, to proliferate. Those are the growth factors, like the IGF, VEGF, that. Those are the growth factors. So yes, those are they are the causes. These are the causes of hyperplasia. So again, in hyperplasia we have types, the physiological type and the pathological type. In physiological type we have two, that is a hormonal and compensatory. So we have already talked about breast, the hypertrophy was there. Same, Hyperplasia is also happening in breast because the number of cells is also increasing, but that is physiological. That is, the body is not trying to escape an injury, that it is just adapting to the change in the environment, what the change in hormones that is happening during puberty. So the breast tissue enlargement is a kind of physiological hyperplasia. And in compensatory, you can see what happens in compensatory. For example, if some part of the liver is donated to someone, or if one kidney is gone, the remaining part has to overwork. So there is compensation happening to whatever that is lost. That kind of an adaptation is called compensatory. That is also physiological. That is, there is no injury happened, but it is trying to compensate what it has lost. And finally, the pathological. That happens because of the hormonal imbalances that we can see in detail. So first one, the pathological, is the endometrial hyperplasia. So you can see, if the person is exposed to more amount of estrogen and not enough progesterone, then there is going to be endometrial hyperplasia, because endometrium is very much linked to these hormones, its proliferation and its shedding, everything. So if there is too much estrogen, there is too much endometrium, EE. When E increases, the other E also increases. So you can see the picture here, that is a normal endometrium, and on the other side we have the endometrial hyperplasia. So this is a section of same testing. This is a normal proliferative endometrium. You can see the glandular cells here, glands there, endometrial glands, and here see there's complex hyperplasia, lot of glands, very thick, and you can see it is very crowded also. So this is hyperplasia of endometrium. So what you have to keep in mind is that if the hyperplasia is not controlled, what happens? It means that it is like a fertile soil for a malignancy to occur. So if the hyperplasia is going on like that, if then the stress is not changing, that means there is a high chance for it to transform into a carcinoma. That is what endometrial carcinoma in case of endometrial hyperplasia. So if the hyperplasia is not controlled, that is the signals that stop the division is no longer working, means what? It is a fertile soil for malignancy. So anything that is in a limit is fine, but more than that is not fine. So that is all about hyperplasia. So we have studied what hypertrophy is and what hyperplasia is. Hypertrophy is the size of the cell changes, that it becomes bigger. In hyperplasia, number of cells increases. So we are done with both. You understood what pathological and physiological means, everything you understood. And the post-mitotic stage of the cardiac and the striatal muscles will not, so that they will not be having hyperplasia happening ever in them. So the third term is atrophy. So what is atrophy? Atrophy means see the factory. Now come back to the factory. Now what happened is that suddenly the people are like, okay, I'm bored with the biscuit. So people like stopped using having the biscuit, and the demand went down, and now see the halat of this factory. It is not working, it is all dirty, no one is there. See, so it has all happening, everything was happening, so happening it was nothing is happening now. That is what is called atrophy. That is, you can see in this, these are the normal cells, and what happens in atrophy? The size of the cell decreases. That is atrophy. Okay. So just see, I have given you an illustration for the causes of atrophy. See what happens in atrophy. What happens is that the cell size and function decreases. So there are a lot of causes of why this atrophy happens. First is the decreased workload. If there is disuse, like you are in bed rest or your limb is immobilized, in all these situations there can be atrophy. In loss of innervation, there is decreased blood supply, enough nutrients is not reaching the tissue, and the person is aging, and there can be decreased hormonal secretion, decreased estrogen or decreased ACTH. All these can cause atrophy. Okay, so what is atrophy? Decrease in size and function of the cell. So these are the many causes of atrophy. So what happens inside a cell? So in atrophy, what in our cell, what happens is the process of transcription where proteins are created. That is how the cell works, no? So the proteins is created by ribosomes. So either in atrophy there is decreased protein synthesis or there is increased protein destruction. That is the two ways that can happen. What can happen inside the cell. So what happens in decreased protein synthesis? Fewer proteins are made. In increased protein destruction, many proteins are broken. Either of any of these can happen in atrophy. Any of these mechanism can happen in atrophy. So let's see the mechanism of atrophy. First one, what you see is metabolic activity decreases and hence protein synthesis decreases. So what does that mean is that if you're not using the limb, or the blood supply is cut off, or not enough nutrient is reaching the cells, then what happens? Obviously the protein synthesis is going to get decreased, the metabolic activity will get decreased, and that can result in atrophy. And another pathway that is involved in atrophy is ubiquitin protease pathway. So let's see what does this pathway mean. So we have it here, ubiquitin proteasome pathway. First you should know what ubiquitin is. Ubiquitin is something that a molecule that binds to the protein that is misfolded, or if there is any mistake in the transcription process and the protein created is misfolded or damaged, or some problem is there, it is not normal, the protein created is not normal, then what happens? This ubiquitin get activated, they connect with the protein and they destroy the protein. That is what ubiquitin does. But how does this ubiquitin get involved in the process of atrophy is that when atrophy happens, that is when there is decreased nutrition or disuse or decreased blood supply, this ubiquitin proteasome pathway is going to get activated. So when this is activated, what happens? When this is activated, this ubiquitin is going to bind to all the proteins that our cell is creating, and it is not identifying whether it is misfolded, damaged, nothing. It is going to bind to the protein that is created by the cell and destroy the protein. So the increased protein degradation happens, or hence the cell function and cell size is going to decrease because destruction is happening inside. That is how the ubiquitin proteasome pathway works. Clear? So this is another thing that we see in atrophy, that is autophagy can be seen. Autophagy means the cell is going to eat itself. It is going to the lysosome is going to break and the entire cell is going to be lysed, and it is like a kind of cannibalism. Like the cell is eating itself because it is deprived of nutrients, blood supply and everything. It is a kind of self-coping up. So autophagy can be seen in atrophy. That is another important point. So that is all about atrophy. The causes, the pathways, how it happens, what happens inside the cell, the protein, there is a increased protein destruction or decreased protein production, and also the ubiquitin pathway, everything is clear, right? So yeah, so we have done hypertrophy, hyperplasia and atrophy. 3 are over. Now we are having metaplasia. So now go back to the factory. What are we saying here? So now what happened is that the CEO was discussing, okay, this biscuit is not working anymore. So we have the factory, everything. We have to convert this business to something else. That is what the CEO is thinking about. So what everyone around is so much interested in gymming, fitness and all. So why don't we start a protein powder company? They are discussing on. So now they have decided, okay, let's convert a global biscuit company to global protein powder company. And now see, they have converted, yeah, they have added all this thing, decorations, and they've converted it into a protein powder company. So there is change in the overall type of the cell, right? So that is metaplasia. That is one well differentiated cell type to another well differentiated cell type. That is metaplasia. Okay. A well-established protein powder company, the well-differentiated cell type. So, change of one adult differentiated cell type to another adult differentiated cell type is called metaplasia. So, why does this metaplasia happens? So, why does it happens is that when there is a change in environment, the cells the cells that are already there cannot cope up with the change. So maybe another form of cell can better cope up with that situation. So what happens? They are going to change into the other cell type which can cope with this change easy, better way. So that is why metaplasia happens. Alright. So this is a very important mechanism that you have to keep in mind about metaplasia. So see, first we have what? The columnar cells. You can see the columnar cells here, and it is columnar epithelium is the original epithelium that is present. Now the change in environment is such a way that there should be squamous cells for better adaptation to the environment change. So what happens is that there is genetic reprogramming. This is the most important thing in metaplasia. That is called transdifferentiation. The cells are going to undergo genetic reprogramming because they are going to become another form of cell, right? So the genes has to change. So the genetic reprogramming occurs, and that is called transdifferentiation. And after this process of transdifferentiation, the original mature cell is converted to another new mature well differentiated cell type. Here in the picture it is from the columnar epithelium to the squamous epithelium. So the process by which the metaplasia happens is transdifferentiation, that is genetic reprogramming. So you have to understand this mechanism very well. This is very basic of pathology. So let's see the examples, very important examples. These are all exam questions. You have to keep this in mind, very important. You'll have to go have this in your mind in your entire life because that important examples these are. Okay, first one is the epithelial metaplasia. So see, I have created an illustration for you guys. Here the cigarette smoking causes squamous metaplasia. Normally, what do you have in your airway? The airway is normally columnar epithelium, right? Ciliated columnar epithelium. So if the person is smoking too much, what happens is that this columnar epithelium cannot survive. So what happens? There is genetic reprogramming and it is going to get converted into squamous cells. So there is squamous metaplasia in a person who is smoking. Okay, so columnar cells are converted into squamous cells for better rehabilitation. But this is actually considered as a double-edged sword. Why is it so? This is considered as a double-edged sword because it is very important for the airway tract to have mucus and the cilia, right? But does the squamous cell have that? No. So we are losing a very important function, and that is going to result in more problems. When one problem is trying to get sorted out by the body, another problem is created. That is why it is called a double-edged sword. So the squamous metaplasia of the lungs is a double-edged sword. And also in some cases this can be just a response and not an adaptation. For example, there can be presence of bone in the soft tissue. That is not an adaptation, it is just a response to these calcifications you see. Okay, for the traumatic, in case of traumatic breast and all, in breast and all, if a trauma occurs, what happens? Calcium gets deposited. It's kind of response. There is another cell type coming in there, but it is not exactly metaplasia. It is kind of adaptation. It is a kind of response, not an adaptation. Okay, trauma response. Okay, second, this one is very important, that is Barrett's esophagus. So what, when you are eating a lot of fast food, junk and all, what happens? You always get that acid reflux. When you always get the acid reflux, what happens? The acid is supposed to be inside the stomach. Inside the stomach, we have all the mucus secreting glands covered with mucus, and the epithelium is protected against the strong acid, the HCl that is there inside our stomach. But when what happens if this acid is going to regurgitate into the esophagus? Our esophagus doesn't have all this protection now. So this acid that is regurgitating into the esophagus is going to affect the cells of the esophagus. It will damage the cells of the esophagus. So what does normally in esophagus, what epithelium is there? It is normal squamous epithelium. Squamous epithelium cannot tolerate this much acid attack on it. So what happens? same process, that is a genetic reprogramming and transdifferentiation happens, and this normal squamous epithelium is getting converted into metaplastic columnar epithelium, because columnar epithelium is a gastric mucosa like, they can more tolerate the acid attack on them. So this squamous epithelium is becoming columnar epithelium. Metaplastic columnar epithelium is going to form in the esophagus. This kind of metaplasia is called Barrett's esophagus, and what you have to keep in mind, it is a pre-malignant condition. If the attack is continuing, then this can lead to esophageal carcinoma. Alright, that is Barrett's esophagus. You should understand the concept very well. This is an important exam question. And now you can see here the normal esophageal squamous epithelium. See, these are the squamous epithelium. You can see on the top the flattened cells. These are the squamous epithelium, and here you see it just look like what the gastric type mucosa with all the invagination glands, the columnar. See the columnar epithelium here with the basal nuclei. So this is called Barrett's esophagus, or the columnar metaplastic change of the epithelium. So here you can make out the difference. And now this is another example of metaplasia, that is vitamin A deficiency. In vitamin A deficiency, what happens is that when there is vitamin A deficiency, the squamous lining of the conjunctiva gets keratinized because there is no vitamin A. That can lead to, what can it lead to? It can lead to keratomalacia. Okay, that is another example. So this what you have to keep in mind is, this is a small, see the size of the trigger I have written. This is a smaller trigger and this is a bigger trigger, right? So when a smaller trigger occurs, what happens? This metaplasia is going to happen from one cell type to another cell type. But what if this trigger is getting bigger and more and continuing for days? Then what have we discussed first? We have discussed squamous metaplasia of respiratory epithelium. So that is going to become lung carcinoma because of the continuous and bigger trigger that it is going on experiencing. And also what we have seen in the esophagus is going to become esophagus carcinoma. If there is intestinal metaplasia of the stomach, then it is going to become gastric carcinoma. So whatever trigger it is, if it is prolonged for a long time, or if it is bigger, the trigger is getting bigger, then this metaplasia is going to become carcinoma. So that you have to keep in mind. There is always a limit to adaptation. We have discussed in the tire, right? The wear and tear can happen, it can adapt and adjust. But finally, if it is going on getting the same trigger, same stress, then it is going to break one day. That is, it is going to result in an injury. In case of metaplasia, it is going to result in carcinoma. Fine. So this is the next term, that is dysplasia. Dysplasia is that in metaplasia, it is from a mature differentiated cell type, one cell type, to another well differentiated adult cell type. Okay, but in dysplasia, what happens? The normal epithelium is going to change into disordered and atypical cells. So what if there is atypical cells, then the chance of it becoming a cancer is very much greater than metaplasia, because already the initial change itself, the cells are atypical. So dysplasia is always a pre-malignant condition or pre-cancerous condition which has the great potential to progress into cancer. So if there is prolonged long-standing pathological hyperplasia, this can lead to dysplasia. Okay, if there is hyperplasia prolonged, that hyperplasia can lead to dysplasia, and dysplasia can finally lead to carcinoma. So that is about dysplasia. And there are two more terms that we are dealing with, that is aplasia and hypoplasia. In aplasia, what happens is there is failure of cell production during embryogenesis, that is during the baby is formed inside the mother's womb. The number of cells, there is failure of production. There is no number of cells are produced. Cell is not at all produced. That is aplasia. And if the cell is produced but there is decrease in number of cells, then it is hypoplasia. Both the examples are given. In aplasia, it is unilateral renal agenesis. That is, one kidney is not there. It is completely absent. That is unilateral renal agenesis, an example of what? Aplasia. And in hypoplasia, for example, in Turner syndrome, we have read about streak ovaries, right? That is hypoplasia. It is the cells are there, but it is not fully developed. There is decreased production of cells. So that is hypoplasia. Example, streak ovaries in Turner's syndrome. So these are two another terms that you have to keep in mind. But the most important ones are the other four. That is hypoplasia, hypertrophy, atrophy, and metaplasia. These four are very important because in almost all the cancers you deal with, these are the basic thing that you need to know. So the recall questions, I just want you to remember what all these terms are, the concept of this, what is trans differentiation, the Barrett's esophagus and metaplasia, and all these important things you have to keep in mind. I have almost covered everything that is there in your basic textbook, Robbins. So just go through all the concepts once more, and then certainly read what Barrett's esophagus is, and keep that concept in your mind because it's very important. So this is a quick revision guide for cellular adaptation I have just made for you. So see, first, this is a normal baseline cells, and here this hypertrophy, the size of the cell has increased. Hyperplasia, the number of cells is increased. Atrophy, the size of cell is decreased. Metaplasia, what another cell type is created. And in dysplasia, see, these are typical cells. See, different kind of cells with weird looking nucleus, cytoplasm, mitosis. These are dysplasia. And aplasia means there is no production of cells, and hypoplasia means there is decreased production of cells. So this is a quick revision of what cellular adaptation is and all the terms that are included in the section. So that is all about cellular adaptation. We have covered almost everything, and hope you understood the concept of cellular adaptation. So next topic is cellular injury. Now the cells are adapted now. Now the stress is going on. So till the next class, the stress will be going on. Let's see what happens to the cells that are adapted now, because the stress is continuing, right? So the next topic is cellular injury, and we'll deal with it in the next class. Hope you understood the concept of cellular adaptation. Please make sure you are well versed with this thing, because this is the most basic thing in the subject of pathology. So see you all on the next class, and we'll deal with what cell injury is and how it happens inside our body. The next drama we are going to deal with. Okay, then till then, read, enjoy your life. See you on the next class, and bye.